And Texas is reeling from the coronavirus crisis, with the state breaking its single-day record yesterday, reporting over 10,000 new cases. There are nearly 300,000 coronavirus infections in Texas, and at least 3,500 people have died. For more, vaccine scientist Dr. Peter Hotez joins me. He is the dean for the National School of Tropical Medicine at Baylor University. Dr. Hotez, welcome. It's so great to have you with us. So, when the coronavirus first started to spread, there were some, including the president, who said it would wane in the summer months. I mean, to be fair, nobody knew much about the virus at that point, but many scientists and doctors still didn't believe that would happen, and clearly it hasn't. Now, Dr. Anthony Fauci says we should hit the reset button. Is he right, and how do we accomplish that at this point?
Yeah, he's absolutely correct. And maybe more than a reset, maybe something more substantive than that, because the nation is going through this massive resurgence. We're now at 65,000 new cases a day. It turns out if you look at all of the new cases per day in the southern United States, they account now for about a quarter of the world's cases. So the southern United States is the epicenter of the global pandemic, and that's a terrible situation. And it's not just cases, as you just reported. The hospitalizations are accelerating steeply. The ICU admissions, and now the deaths. And by the way, no one's even talking about all the permanent injuries that we're seeing, permanent damage to the lungs of people who survive neurologic damage, cardiovascular damage. So we have to stop this, and we have to stop it now. And to do that, I think we have to really look at, Dr. Fauci calls it a national reset. I would say we have to really bring the country back to what I call containment mode, 1 new case per million residents per day, and do that by, say, a set date, end of September, October 1, so we can open up our schools again and have some semblance of life. The country can't continue going on like this.
And of course, you are in Houston, where the numbers are surging. Governor Abbott shut down bars there this week, but did stop short of his threat to shut down the state again. Can you get the results in Texas, like we've seen here in New York, without a full-blown shutdown, using a piecemeal effort? Or what do you think needs to be done there in Texas?
Yeah, I don't think so. I don't think these piecemeal measures, we keep adding them on as we're not getting the result we want to achieve. And the problem is, if any public health intervention you do, it's a couple of weeks before you could see the results of that. I think what would be more straightforward is to do a shutdown of all of the states that are severely affected in the South, bring us back to some kind of containment level, then reopen again, this time having all of the appropriate public health infrastructure measures in place. And then you could do things like opening up schools and colleges safely. Right now, I don't see, if you're a school teacher or a bus driver in a part of the state where there's a lot of transmission going on, I don't know how you feel safe going to work at this point. And it's not only Texas. This is true in Arizona, New Mexico, and Southern California, and on the other side of Texas and Louisiana, the Gulf Coast states, and Florida. This is a national tragedy, and we need to address it as such. And until we get that intervention, that guidance at the federal level, just leaving it to the governors is clearly going to remain a failed policy.
And of course, the virus does not respect state borders, as we know. And New York Governor Andrew Cuomo, along with other governors who've gotten a handle on this virus more or less, have expressed concern that the virus might seep back in from other hotspots. Is he right? Is New York just one plane flight away from once again becoming a hotspot, or one school opening away from a resurgence?
Sure, and people are driving, crisscrossing the nation in multiple modes of transportation. Look, what we're playing right now is what I call this Pyrrhic game of whack-a-mole, where we're knocking down virus in one part of the country and it's popping up somewhere else. And we'll just continue to do that until we can, as I say, shape that national strategy that says by October 1, we'll bring the whole country to containment mode, meaning around 1 case per million residents per day. And different states will have further to go to get there. In Maine and Vermont, we might already be there at that point, whereas in Florida, Texas, we'll have to do that shutdown. But if we can all then get to that same point by October 1, there's no end to what our nation can do. Open up schools and colleges. We could even have college football in the National Football League potentially. But again, you can't ask the individual states to do this. It has to be done at the federal level, and that's what we're so hungry for right now, is that national leadership to make that happen.
And Dr. Hotez, you've recently come out and criticized the federal government for its lack of leadership. You said you started out when all of this began not wanting to make this political, but you've come to a place where you've decided that it's actually immoral at this point not to make it political. I want to ask you about this recent move by the federal government stripping the CDC of control over its own data, as well as apparently blocking the public from accessing it. Do you think that that's a dangerous move?
I don't really know the details on what was done there and the rationale for it. I'm hearing different things from different aspects, that it was to better understand the data, have more access to the data. But even putting that piece aside, here's what we have out of the White House is a pretty clear disinformation campaign, denial that there's a problem, and using words like this massive resurgence, calling it embers, or saying 99% of the cases are harmless, or deflecting the Chinese Communist Party conspiracy theories, or blaming the World Health Organization. This is clearly not the basis for it, and that is creating a lot of damage. And the reason I spoke up is because the consequences are particularly among the vulnerable and low-income neighborhoods, I think, are getting decimated across the metro areas of the southern United States. And I don't have all the data to support it, but to me, it's looking like Hispanic, Latinx communities are just getting devastated right now, especially in low-income areas of cities like Houston and San Antonio. When you look what's happening down in South Texas, I'm just aghast at what I'm seeing in terms of patients not even having access to the medical care they need, and hospitals getting overwhelmed. And it's not just the beds. If you talk to the nurses and the docs and the techs, they're exhausted, donning and doffing PPE multiple times a day, and now they're getting sick. And we know that that's a very treacherous place to be, because when hospital staff start getting sick, and then they require replacement, that's when the mortality figures start going up. That's where you saw that high mortality rates in Spain and Italy over the spring, or in the early part of the epidemic in New York City. All of those things are playing out again across the hospitals in the metro areas of the southern United States. And so this was both predicted and predictable, and we're not stepping up to take care of it.
Dr. Peter Hotez, thank you so much for bringing this important information to light, and for joining us today, and for all you're doing fighting this terrible virus. Thank you.
Thank you.